Hey, nursing students, and welcome. Today, we're going to break down one of the most fundamental skills you will ever learn. Seriously, this is a core competency that literally saves lives. And you know what? Mastering it is going to give you so much confidence on the floor, right from day one. Okay, let's dive in.
All right, let's just kick things off with a big question. I guarantee you this will pop up on your exams and you're going to live it out in your practice every single day. The answer to this? It's the absolute bedrock of patient safety.
And the answer is, of course, hand hygiene. But let's be super clear here. This isn't just about, being clean. This is a fundamental professional skill. It's like a shield that protects not only your patients, but you too, from the constant threat of germs being passed around.
So, we've set this explainer up just like a mini lesson to give you a really clear roadmap for getting this skill down pat. We're going to cover the why, the prep work, the two main methods you'll use, and then we'll wrap it all up with a checklist that's perfect for your exams.
Before we jump into the how, let's really ground ourselves in the critical why. Because understanding this part, well, that's what separates just going through the motions from truly safe practice.
Okay, think of these moments as the absolute, non-negotiable times for hand hygiene. Each one is a critical control point where you personally, have the power to literally break the chain of infection. Doing this at these key moments is what keeps your patient safe, and just as important, it's what keeps you safe.
Now, here's something that honestly often gets overlooked. Before you even decide, am I using soap or hand rub, there's a whole set of universal prep steps. And getting these right is absolutely crucial, because if you skip them, the rest of your technique might not even matter.
Think of this like your pre-flight check before takeoff. Any little cuts can harbor bacteria, jewelry is a notorious hiding spot for germs, and your wrists need to be totally exposed. If you ignore these simple things, all that scrubbing you're about to do could be for nothing.
Okay, pay super close attention to this number, 1/4 of an inch. Lock it in. This is a classic NCLEX style detail they love to ask about. So why is it so important? Well, that area right under your nails, it's called the subnungal area, is where the highest concentration of microorganisms on your hands loves to hide. So keeping your nails short isn't just a policy, it's a really powerful and simple infection control measure.
All right, let's get into our first method, good old soap and water. This is going to be your go-to technique anytime your hands are visibly dirty or soiled with anything. Every single step here has a clear reason behind it. You stand away from the sink so your uniform doesn't get contaminated. And keeping your hands below your elbows, that is so critical. It makes sure water flows from the cleanest area, your arms, down to the most contaminated area, your hands, and then right into the sink.
And here is where the real work happens. It's all about friction. That vigorous, circular scrubbing is what physically pries the microbes loose from your skin. Don't forget to get under those nails. And this last step, it's a big one. Always use a new, clean paper towel to turn off the faucet. If you don't, you risk recontaminating your perfectly clean hands right at the very end.
This timing is something you just have to burn into your memory for your skills check off and for your entire career. We are talking about a minimum of 15 to 20 seconds of vigorous scrubbing. You've got to cover all the surfaces. A great way to time it is to sing Happy Birthday in your head twice. Don't rush it. That's how long it takes to really get those germs off.
Oof. This is such a common failure point, both in skills testing and out on the floor. The inside of that sink is considered highly contaminated. If your clean hand touches it, I'm sorry, but you have to start the whole process over. This is exactly why using that clean paper towel to turn off the water isn't just a nice idea, it's a mandatory final step.
Okay, on to the method you'll probably use most often, especially when you're moving between patients. We're talking about the alcohol-based antiseptic hand rub.
So this is the decision you'll be making all day long. When do I use which one? Well, this slide makes it really simple. If you can see anything on your hands, you have to use soap and water to physically remove it. But for all other routine care, when your hands aren't visibly soiled, the alcohol rub is actually the preferred method. Why? Because it's faster, it's more effective at killing germs, and it's less irritating to your skin.
The keys here are exactly the same as with soap: coverage and friction. You have to get that rub on every single surface of your hands and wrists. And this is important, you have to keep rubbing until it is completely dry. That's your signal that the alcohol has evaporated and done its germ-killing job. Yep, this is a direct takeaway from all the best practice guidelines. And why is it preferred? Well, like we said, it's actually more effective for routine use, it takes less time, and it's generally a lot less harsh on your skin than washing dozens of times a day. It is the standard for a reason.
You know, it's so true. Mastering these foundational skills is what builds a fantastic nursing career. And we're really dedicated to helping you do just that. If you're finding this helpful, make sure you hit that subscribe button so you don't miss out on our next Nursing Explainer.
Okay, we've gone through all the steps in detail. Now, let's lock in the most important concepts and the whys behind them. This is the stuff you absolutely need to know for your exams and for your clinicals.
You see, understanding the why behind every action, that's what's going to take you from just memorizing steps to truly mastering the skill. These rationales, they are your secret weapon for critical thinking on exams and for making safe, smart decisions in real-world patient care. And of course, learning doesn't stop here. When you're ready to take your studying to the next level, we've curated some of our favorite NCLEX resources for you. We've dropped the links in the description below, so be sure to check those out.
And that's a wrap on our hand hygiene deep dive. If this helped you feel a little more confident, do me a favor and give this explainer a like, and definitely share it with your study group. Let us know in the comments below, what was your #1 key takeaway? Now go forward and be a safe practitioner.